Welcome back to The Explainer. Today, we're diving straight into a pretty harrowing medical case study of a true silent killer hiding right in plain sight. It's a story that starts out completely ordinary, just everyday life, and then suddenly pivots into this terrifying medical mystery. Everything we're unpacking today comes directly from the first-hand account of a woman named Nozomi who actually documented her shocking diagnosis. It's an incredibly compelling look at just how easily our bodies can conceal massive changes, and why paying attention to the smallest details is absolutely critical for our survival.
So I really want you to stop and ask yourself, what happens when a silent killer grows to 4.5 times its normal size inside of you, literally without giving you a single undeniable warning? I mean, we all get aches and pains, right? We all feel tired or a bit bloated from time to time, but how do you distinguish between the mild everyday symptoms of just getting older or having a super busy life and a severe medical condition masquerading as something harmless? As we're going to see in Nozomi's case, that line between "I'm just tired" and "I need emergency surgery" is terrifyingly thin. Let's start by looking at the startling physical reality of her situation.
Section 1. The Silent Killer. And this brilliantly illustrates the sheer scale of the problem. A standard, healthy ovary is tiny. We're talking just 2 to 3 centimeters. But the tumor discovered in Nozomi, 9 by 9 by 7 centimeters. If you take out a ruler and actually measure that out, 9 centimeters is massive for an organ that's naturally supposed to be the size of an almond. Basically, her ovary had grown to nearly 5 times its normal size. And because ovaries sit deep down within the pelvis, doctors can't just easily biopsy them like they might with, say, cervical cancer. They won't know with 100% certainty if it's benign or malignant until they completely remove it through surgery and run pathology tests. So, until then, there's this constant, looming risk of the ovary twisting, which cuts off its own blood supply in a process called necrosis, or even rupturing, which would cause absolutely agonizing pain. But how does something grow that large without the patient rushing straight to the ER? Well, let's shift the narrative back in time a bit to explore some early medical history that was surprisingly easy to dismiss.
Section 2. Ignoring the warning signs.
So get this. 6 years prior, Nozomi actually had a 5-centimeter swelling in her left ovary. At the time, her doctor suspected it might be endometriosis, but because she was hoping to get pregnant, they opted out of any aggressive medication. You see, they noted that pregnancy often resolves endometriosis naturally. And sure enough, she had a completely healthy pregnancy, delivered her second daughter, and in her follow-up checkups, her ovaries appeared perfectly normal again. But that history kind of lulled her into a false sense of security. Because of that past experience, she just assumed any pelvic discomfort was a totally normal part of her cycle.
Which brings us to a highly relatable but ultimately critical moment in June of 2024. Nozomi was experiencing some really severe ovulation pain. It was bad enough that she actually called to book a cancer screening. But she was told that because her HPV test from a year prior came back negative, her next covered screening wasn't due for another 3 years. If she came in right then, it would be a totally out-of-pocket expense. Between the cost, the lack of any visible bleeding, the fact that she already had a history of painful periods, and, let's be real, just being incredibly busy with work and raising 2 kids, she canceled the appointment. It's such a relatable choice for busy women, isn't it? Putting your own health on the back burner just to avoid inconveniencing others or paying extra fees. But as we all know, the body has a way of forcing you to pay attention eventually, and it often builds into a full-blown medical crisis.
Section 3. The diagnostic timeline.
Let's walk through this exact timeline together, because it really highlights just how grueling and drawn out a diagnostic process can be. On December 5th, her normal period started. Simple enough. But the very next day, December 6th, she was hit with a sharp, piercing pain right below her navel. She knew it was completely different from her normal cramps, and it came with a 38-degree fever and terrible nausea. Still, she just took some over-the-counter painkillers and toughed it out. It wasn't until 2 whole weeks later, on December 20th, that she experienced sudden, heavy, and completely unexpected bleeding. That was the final straw that pushed her to leave work early on December 23rd for a clinic visit, and that's exactly where they discovered the massive 8 to 9 centimeter swelling, kicking off a month-long marathon of hospital transfers, waiting, and testing, which finally culminated in a specialized MRI on January 23rd.
Throughout this whole agonizing timeline, doctors repeatedly told her they had to just wait. They needed to see if the swelling was simply a temporary hormonal cyst that might shrink after her next menstrual cycle. So they kept sending her home to wait for 2 agonizing weeks at a time. And because the ovary was 9 centimeters large, doctors explicitly warned her that it could rupture at literally any moment. And if she felt sudden, severe pain, she'd need emergency surgery immediately. As Nozomi perfectly described it, I felt like I was carrying a ticking time bomb. I mean, just imagine trying to go to work and take care of your little kids while knowing an organ inside you could just burst at any second.
Okay, so on January 23rd, they finally performed a contrast MRI to get a crystal clear picture of what was happening inside her abdomen. For those who don't know, a contrast MRI involves injecting a special dye through an IV, which basically makes blood vessels and tumors light up clearly on the scan. But this step also highlighted the intense psychological toll of this entire process. Nozomi was so incredibly anxious about the whole situation that when the nurse initially failed the IV needle insertion, Nozomi became dizzy, totally nauseous, and actually nearly fainted right there in the imaging room.
Alongside the MRI, they also ran a tumor marker blood test. This essentially checks for specific proteins or substances in your blood that often elevate when a malignant cancer is present. Now, Nozomi's tumor marker thankfully came back negative. Huge relief, right? Well, yes, but the crucial point here is that a negative blood test isn't a 100% guarantee. Because of exactly where the ovaries are situated deep in the pelvis, her doctors told her that they simply cannot guarantee it is entirely benign until they physically open her up, take the mass out, and put it directly under a microscope. And seeing this imaging finally forced Nozomi to reevaluate the past 6 months of her life.
Section 4. Hidden symptoms revealed.
Now, what's really interesting about this is that once she knew she had a 9-centimeter tumor, a whole wave of retrospective symptoms suddenly made perfect sense. Over the previous 6 months, she had noticed her stomach protruding, but she just chalked it up to gaining a bit of weight and getting older. When she slept on her back, she felt this heavy, sinking sensation in her abdomen. When lying down, she had frequent urges to urinate. But most surprisingly, when she was sleeping in bed between her 2 young daughters, she would often quickly roll over from one side to the other to face them. And when she did, she'd get this sharp, popping or cracking pain in her lower abdomen that would literally freeze her in place. At the time, she thought it was just muscle cramps from aging. In reality, it was likely that massive tumor physically shifting around in her pelvis.
And if you want to know exactly why she had a protruding stomach and frequent urination, well, the MRI revealed that the tumor was actually taking up approximately 50% of her abdominal cavity. You heard that right. Half of her lower abdominal space was being occupied by this mass, pressing down heavily on her bladder and pushing her stomach outwards. Medical crises like this don't just happen in a vacuum, you know? They ripple out, they affect everything around you, and they lead to immense collateral damage in your daily life.
Section 5. Impact on daily life.
Surgery was scheduled for the earliest open slot, which fell in early March. The planned procedure is a laparoscopic surgery, so minimally invasive keyhole incisions, though the doctors did warn her they might have to pivot to open surgery once they actually get in there and see what's happening. The whole process requires a full week of staying in the hospital, followed by another full week of strictly resting at home. That means Nozomi has to take at least 2 full weeks off from her job, which understandably left her absolutely overwhelmed with guilt for burdening her coworkers.
And it deeply humanizes this whole clinical diagnosis when we zoom out and look at her family. Her husband normally leaves the house at 6 a.m. and doesn't get back until 7 p.m. But during her hospital stay, he has to take a full week off work to completely take over the household. He'll be managing all the chores, all the childcare, and getting the kids to their schools and extracurricular activities. And in a very sweet, grounded little detail, her surgery happens to coincide with her younger daughter's rare school field trip. So her husband actually committed to attempting his first ever character bento. You know, those highly decorative Japanese lunchboxes, just to make sure his daughter doesn't feel left out while her mom is stuck in the hospital.
Despite the incredible guilt of inconveniencing her job and totally upending her husband's schedule, Nozomi had a very raw emotional realization when she was asking for time off work. She summarized it perfectly with this exact quote: "I am so sorry for the inconvenience, but I don't want to die yet." Wow. It absolutely grounds all these clinical medical facts in pure, basic human survival instinct. At the end of the day, you have to put yourself first. Which brings us to a vital necessity for all of us watching this.
Section 6. A call to action.
So, the crucial point we need to take away is this: ovarian tumors and even ovarian cancers are notorious for being silent. If Nozomi had not experienced that one bout of unexpected heavy bleeding in December, which, by the way, actually happened right around her ovulation time and could have easily been dismissed by some as just ovulation spotting, she would never have gone to the clinic. The tumor would have just kept growing completely silently. Even if it was currently benign, her doctors noted that leaving it in place increases the risk of it eventually mutating into a malignant tumor without the patient ever feeling a thing, until it's much, much too late.
This leaves us with a critical question to consider as we wrap up this explainer.
Are you ignoring these subtle warning signs your own body is sending you right now? Are you writing off a sharp pain, a weird feeling of heaviness or sudden fatigue as just getting older or being busy? Nozomi's story is a powerful, real-world reminder that our bodies communicate with us in whispers long before they start screaming. Please don't put off your regular checkups, and never, ever let the fear of being an inconvenience stop you from advocating for your own health. Thank you so much for joining me for this explainer, and please stay healthy out there.